There have been instances where ill people have refused to be swabbed for COVID-19. This was confirmed by Chief Medical Officer Dr. Roshan Parasram during Wednesday's virtual COVID-19 update. He said it is a person's right and added that people cannot be forced to be swabbed for the virus. Sunil Lalla has the details.
The number of COVID-19 samples collected over the last 2 weeks has decreased, with the Chief Medical Officer attributing this to a drop in fewer people exhibiting viral symptoms. He said based on his weekly reports received from both the public and private testing sites, only an average of 400 to 500 samples have been collected when compared to a few weeks ago, which averaged 600 to 700 swabs. In August and mid-September, the CMO noted that tests averaged around 1,000 per day. But Dr. Parasram revealed that some people who would have presented with flu-like symptoms refused to be swabbed.
So it is a function. We are trying to swab as many people as we can once they come in with any viral symptoms, no matter how mild they may be. But of course, people can refuse swabbing, and they have, in a lot of instances, said they don't want to be swabbed for whatever reason. But we try our best to swab everyone that presents to us with viral illness.
The Chief Medical Officer noted that swabbing is a voluntary process and said that those who refused were given instructions to self-isolate for a period of time.
What we have been advising is that persons self-quarantine or self-isolate, for the period of their illness to prevent the spread of whatever it may be. It may be the common cold, but even so, we want to keep the viral levels low. If we are not able to swab, we're not able to tell on the outset whether it is COVID-19. So we can err on the side of caution and say quarantine for the period of time or isolate for the period of time.
Meanwhile, Dr. Parasram added that generally, any patient can refuse treatment for any condition and can also seek to be discharged against medical advice. But he reminded that under the Quarantine Act, anyone that has COVID-19 can be ordered to isolate.
If someone looks as if they have COVID-19, it gives us the authority to quarantine or isolate that person under law until we either deem them non-infectious. We may not be able to administer any treatment. We may not, if they refuse, but at least we can isolate them to prevent the spread of further diseases.
Dr. Parasram, however, did not give further details as to how many people refused to be swabbed. Sunil Lalla, TTT News.